so from the knee and the hip to the elbow.
Okay.
Let's show a 3D image that we have of an elbow. And there's also surgeries for here as well. Doctor, tell me what happens.
Well, I mean, this is a mock-up of an elbow here. You can see the humerus, radius, and the ulna. The elbow is a complicated joint. It's a rotating hinge made up of 3 bones. Elbow surgery, much less common. Usually when we see patients that require elbow replacements, we're dealing with patients with other forms of arthritis, rheumatoid arthritis being the most common, or severe injury due to trauma, falls, car accidents. But basically this portion, which is the end of the humerus, is replaced with a metal implant, as is this portion, which looks almost like a saddle, the ulna, and in addition the radial head. But that is something reserved for patients with very deforming arthritis or bad injuries.
And then I've also heard, doctor, shoulder surgeries where that is, I'm going to assume that's trauma.
You know, shoulder replacement surgery is actually much more common than elbows. We see it for many reasons. Osteoarthritis being chief, but we also, more and more, we are replacing shoulders due to trauma, fractures, and those patients actually do very well.
They do?
Yep.
And what kind of, what does that surgery look like? Well, it's because you think of, wow, that's a big part.
It is. It's a similar process to a hip or a knee. You know, it's a single incision over the anterior aspect of the shoulder. You remove the ball. You replace, it's not really a socket in the shoulder, but similar idea. Both of those things are replaced. There are several different types of shoulder replacements, but basically you take a worn out part, you replace it for something shiny and new, and then you get it moving.